In this video, we're going to break down what might have happened here with Danilo Gallinari as he suffered this non-contact left knee injury. Welcome back, everybody. I'm Dr. Brian Sutterer, and if you're new here and enjoy learning about the medical side of sports injuries, then please be sure and subscribe so that you can stay up to date with when I release future videos. Hopefully, basketball fans are about to learn from what we saw take place in the NFL recently with Zach Wilson. This idea that just because an injury has a certain mechanism to it, that doesn't guarantee that the worst case scenario is going to happen. This back view is certainly the most concerning for Gallinari. We can see just as he plants with that left foot, that knee drastically falls inward into that position that we're oftentimes worried about with an ACL tear. There didn't appear to be any real contact, so we would certainly consider this a non-contact knee injury. Another thing from the side view is we can see Gallinari lands with a relatively straight or extended left leg on a relatively flat foot. So big sudden impact, big sudden ground reaction force, axial load up through the knee and a relatively straight leg. So again, something that mechanistically fits with an ACL tear. But this is the important lesson to learn about this. Initially, we saw some reports from Italy's coach that they were worried about the cruciate ligaments. Of course, ACL stands for anterior cruciate ligament. But then we saw a report from the team doctor saying that the ACL felt intact on their physical exam, and then Shams reporting same that the ACL felt intact on physical exam. Non-contact injuries occur because the body is subjected to forces through these various injury mechanisms. With a non-contact ACL tear, we often see an athlete trying to plant and cut, landing on a flat foot, relatively straight knee, and then as a result, we see that knee cave inward, and sometimes that shift where the tibia pops forward because the ACL has been torn. So there's a pattern that we see with ACL injuries. But just because we see that pattern of movement doesn't mean that the force is always high enough to cause trauma to the ACL. There's a spectrum of severity in terms of what tissue can be injured, with a resulting difference in the prognosis. So even though with Gallinari, this certainly looks like a mechanism that could fit with an ACL tear, we can't reliably 100% predict just from the video without seeing that tibia move that the ACL is intact or the ACL is torn. If we compare this front-on view here, again, he plants, that knee falls inward, to then what we saw when Jamal Murray did tear his ACL, left leg plants, knee sort of falls inward. And more recently with Zach Wilson, he plants with that right leg, knee shifts inward ever so slightly, but ACL was fine, just had a meniscus tear. If we think of Gallinari's knee in this position compared to the anatomical structures, there are still different things that are going to be stretched, that are going to be compressed or pulled on, that can result in other injuries on this spectrum. First of all, when those bones, the shin bone and the thigh bone, pivot like that and move relative to one another, you can get a bad bone bruise just from the two ends of the bone literally impacting on one another and causing this compressive force. Sometimes, depending on how much the knee goes inward along with that movement, you can develop an injury to the MCL, the medial collateral ligament that runs on the inside from north to south of the knee. Similarly, the menisci, the little cartilage structures, the cushion inside the knee, can be injured along the spectrum. So what we have is a mechanism, but depending on the exact forces and the way that the body absorbs those forces, we can have anything from a simple bone bruise to a meniscus tear to an MCL injury, all the way up to a full-blown ACL tear. With Gallinari, it's great that the initial exam shows stability with that ACL. Keep in mind, Gallinari has injured this ACL in the past and had surgery on it, so that can always make things a little bit more challenging depending on exactly how tight the ligament was when it was reconstructed, and the MRI is going to ultimately prove the final answer here. Best case scenario here, we're just dealing with a bone bruise that keeps somebody out on the order of weeks to maybe a month or so, but certainly this has the potential to be something more like an MCL, meniscus, or an ACL, even in the setting of a normal physical exam, because those exam tests aren't 100% perfect. But what I want you to take away from this video is that idea that we have an injury mechanism, but depending on the exact forces, you can have a varying severity of actual injury depending on how the tissues absorb those loads. That's it for the video, everybody. Let me know as always any questions or comments down below, and until next time, we'll see you later. Bye.